there's a stigma associated with talking about vaginas, or what's the problem?
I mean,
guys have no problem talking about their junk. I mean, come on. I'm being facetious, but I'm a nurse. I'm comfortable talking about every body part. And when I had the training for the Thermiva, they said, talk about the vagina like it's an elbow. It's not a big deal. All of us women, like 98% of my clients are women. So we all got one, girls, and it's time that we share freely. I will educate you guys about anything that you want to know. And I've had requests, a few women, when I've done hair removal, they're like, oh, they were self-conscious about the inner labia.
Yeah.
And that's something that you can fix.
Absolutely. I mean, it's not about normal or abnormal.
Right.
All right? Every woman that I operate on is normal. But you're allowed to have bothers. If you if you're small-breasted and you feel uncomfortable, you have the option to change. You have the option to get a breast augmentation. Well, there's evidence-based medicine that women and men feel a connection between their genitals and confidence and in their ability to orgasm. So having the ability to change things more to your liking are not only advantageous to your mind, but also to your sexuality.
Makes sense. I mean, if you're self-conscious about, you're like, oh, they're looking old as I've gotten older or whatever, you're not going to be able to give into the moment.
Absolutely.
And your partner's going to be frustrated too, because like, you know, what's the problem?
Yeah.
I'm going to nip it in the bud right there. I'm not going to elaborate. I was going to say a lot more, but my clients, I'll talk to you guys one-on-one in the privacy of my room, where I can share more intimate details. But you know what? I can help women look younger. I'm 59. But there's a part of us that continues to age, and vagina is one of them. And I am a huge advocate for, I want to be active in every aspect of my life and feel young. And if I'm peeing when I'm jogging, I'm not feeling young.
Right.
I'm feeling like an old woman. So that's why I'm hoping that, you know, doing a series of these treatments will assist me with that. And
I think we're going to be doing that today.
we are. You guys are not going to be seeing it from his angle, but you'll be seeing it from my angle. I'll be able to educate you guys and let you know what my experience is, because there's nothing I won't do for, you know, to educate people and to get people excited about something different. How long has this technology been around?
It's been around for several years, 7 to 10 years. Just not a lot of people are sharing. I think that's the biggest thing. I think that's the biggest take home today is stop the silence. Know that you're not alone. Be able to share your experiences, not only your birth story, but share your experiences about menopause. Share your experiences about genuine stress incontinence or painful intercourse, or that you just don't like the way your genitals look. There's nothing wrong with it. But begin to share. Stop the silence. You're not alone.
It's true. And I'm more likely to initiate a conversation because most of my age group probably has experienced what I have with menopause, things painful sex, lack of lubrication. And my mom died, you know, before I came into menopause, so I didn't have anybody to ask, you know, is this normal?
Absolutely.
And I didn't ask anyone. So my patient would say, oh, honey, that just happens as you get older. But the fact is, it doesn't. We can be sexually active, I'm going to say into my hundreds, but we'll see. That's going to be my goal, into my hundreds.
That's right.
But there's no reason we can't, right?
No reason, not so much. It's not something that you have to live with. I mean, sex is one of the most fun things you can do without smiling, and for free.
Yeah.
You know what I mean.
Yeah, I know I do.
But yeah, there's no reason to think that you can't have sex until the day you die.
Right. And I think hormone replacement plays a huge part of that.
Absolutely.
As well as these other procedures. Now, labiaplasty, how long has this procedure? Is this one that you said has been around 7 years? Or that you're talking
No,
about
I was talking about FemiLift has been around, fractional CO2.
So how long
Labioplasty has been around for 20, 30 years.
Have techniques changed?
The techniques are two different types of techniques. One is a trim, where you actually just trim the edges of the labia, and another one is a wedge, where you actually take a pie-shaped incision out of the labia and then bring the top to the bottom, both acting to shorten and change the design of the labia.
Is there any bleeding? I watched some of your videos, and it didn't seem like there was very much bleeding at all.
No, you lose very little blood.
Are there stitches, or do you cauterize?
We use sutures.
Okay.
We use a combination of both. This is a 2-layered closure to the labia. We use one suture that stays around for about 90 days,
Wow.
and then a second suture that brings the skin edges together, and that only stays in place for about 7 to 10 days.
Does that dissolve, or do patients have to come back?
Both of them, they completely dissolve on their own.
Wow.
And so you can kind of contour your labia to however you desire. I think the important thing, one thing that sets me apart is that I'm very facile in both techniques. Many times you'll find most of the surgeons will say, I either do trim or I do wedge. Well, if you're at one of those two camps, most women will look good in either procedure, wedge or linear. But there's about a 20% of women where their anatomy calls for either linear or wedge. So if you're not facile and being able to do both,
you're referring out.
You're referring out, or you're just getting your garden variety labioplasty that your surgeon only knows how to do.
And it's not serving them well.
Right, not necessarily what your cosmetic desires are or how you want things to look.
Have you seen a trend in labias changing over the years?
Most women now want their labia minora to be tucked, meaning
I
not to
read
go
that
beyond
you were saying,
the labia
Barbie
majora.
or something?
Yeah, they call that the
Okay.
Barbie. Actually, Dr. Red Allensaw coined that term.
Oh, he did?
Yeah,
well,
Barbie.
Got to give him credit for that. That's not my look per se, but I see more of that with the younger girls. But I mean, are women my age coming in and requesting a Barbie?
Some are.
Vaginoplasty?
Yeah, everyone is variable. Everyone has the choice to do whatever they want.
Okay.
And the ages can be as young as 14, and the oldest has been 81.
Oh, that's amazing. I love it.
Yeah.
I've just learned so much today.
So cool.
I am so amazed. It was maybe not the best time to be showing vagina photos at the convention, but or maybe it was. I don't know. It was not a big deal to me. But you guys are going to have to check out his website. I'm going to be putting links to website, Instagram page. What other links?
Facebook.
Facebook.
And YouTube.
Okay. I'll put links to all that so you guys can follow. He's got great detailed photos and videos. Yeah, there's just so much. And
I'm excited to do this procedure on you and see what your thoughts are and what your outcomes will be. Make sure you share it with everybody. Stop the silence.
Of course.
Okay.
I high five, yes, I guarantee you. You're going to be seeing posts on my Instagram page regularly.
I'll be looking.
And we'll include something fun from here on my raffle to benefit Sacramento Shelter Pets Alive. It's a fundraiser that I'm passionate about dogs, so it's a fundraiser that I'm having to raise money for them.
Okay.
And you girls just reach out to me, direct message me. Can they direct message you?
Sure they can,
Do
absolutely.
you answer all your messages?
Yep.
Okay.
Yep.
And if you have any specific questions, you can always call me at the office as well. I want to wrap up with, what are your hobbies? What do you do for fun?
I spend a lot of time with my 3 younger boys. My boys are 4.5, 2.5, and 1.5. So I think that says it all. That's what I'm spending my time doing.
Okay.
So we enjoy it. We ride bikes in Davis. We ride as a family. We go to the farmer's market, and we play at the park and have movie night on Fridays. So that's kind of my life right now.
Oh, life is good.
Yeah, absolutely.
And how many days a week are you here?
I'm here every day of the week.
Okay, Monday through Friday?
Yes.
Okay, and what hours?
9 to 5.
Okay.
Yep.
All right, you guys. So just wrapping things up. You know how I like to end. Be kind, love your pets, and stay beautiful.